made it way metaphorically. King Kunta, highs on prize, my pride won't collide. Am I right in your eyes if I stand on mine? You are royalty. We got a message from above. You ain't no love. You're royalty. Brother, you're a king. Sister, you're a queen. Children of the dream. If you've never been told, time for you to know you're royalty. If you've never been told, time for you to know you're royalty. You're royalty. If you've never been told, time for you to know you're royalty. If you've never been told, time for you to know you're royalty.
Welcome to the Sweet Lady and OT Gospel Show. Hello, everyone. All right, we're testing these mics here, but we are here today. Thank you so much for tuning in to the Sweet Lady and OT Gospel Show. We are here today to lift up Christ as we do each Saturday here on the Smash Bros Radio on Sweet Lady and OT Gospel Show. And hopefully everyone can hear us good today. Those who have joined in, we sure would appreciate some feedback if you would help us out that way. And let us know if we are coming across loud and clear. All right. I think my bed music may be up a little bit too loud, JB. We have JB on the board with us. OT is not here today. And we have a special guest in the studio today that will be discussing with us the real of mental health. We know that mental health is just as important as all the rest of our health. And we know that mental health plays a big part in so many things that go on in our lives, in our world, and we want to know how to help ourselves in every area, in every aspect of our lives. Thank you so much for that, DJ. Appreciate that feedback. Thank you so much. And shout out to Cash. I see Cash on the line and Shawana Shea. Thank you all so much for tuning in. But before we get to our guest, we're going to quote our scripture here, and that is St. John 12:32. And if I be lifted up from the earth, will draw all men unto me. That's what Christ wants us to do. He wants us to lift him up in everything that we do and everything that we say. He is to be admired. He is to be lifted up and magnified and glorified and praised and giving him gratitude and for those things that he does for us. And we know at this time our country, our world is kind of like going through something. But we know who controls everything. We rely on our Heavenly Father because this is his world. I don't care how things seem like they get out of whack, they get out of order, but God is still in control. And we can rely on that. We can depend on him because he said his word is forever settled, and whatever his word says, that's what's going to be no matter what. So we don't have to worry. We can cast all our cares upon him because we know that he cares for us. And without further ado, we're going to introduce our guest to you today. And our guest is Mrs. Lanetta Harper, and she is with New Paths Foundation. She is a mental health counselor, and she's a therapist, and she provides counseling for depression and anxiety, stress, trauma, and anger management, family counseling and play therapy, support group for coping with and life skills.
That's correct.
And she is here today, and we're going to be talking about anxiety. We know anxiety affects So many people. But we're going to let Mrs. Harper tell us the stats and all that because I don't know the stats. Mrs. Harper, without further ado, can you tell us a little bit about who you are and what you do? I know I read an introduction, but you can tell us more about who you are and what you do.
Yes, ma'am. I am a licensed professional counselor. I'm located in Hoover, Alabama, and I enjoy servicing the community.
Okay.
And you actually said something just a few minutes ago. There's a whole lot going on in our world right now
Right.
that is increasing our anxiety.
Mm-hmm.
And so I just wanted to talk a little bit about anxiety and the different types of anxiety
Okay.
and explain
Mm-hmm.
and to kind of shed light on what it actually is, because a lot of people don't really understand anxiety. They just assume it's just a physical feeling.
Uh-huh.
Well, it's very complex, and it's
Okay.
a lot of things involved.
Mm-hmm.
And so I got some cheat sheets here, and as
Okay.
I was sitting, I decided to jot down a few things that I wanted to talk about.
Okay.
And so some of the anxiety specifics, when you hear anxiety, we want to think disorder
Mm-hmm.
as opposed to disease.
Uh-huh.
So when you hear the word disorder, every organism, every mammal has a function of behavior,
Mm-hmm.
right?
Right.
So when you're disordered, you're going away from your normal function.
Mhm.
So anxiety disorder is looked at in a behavioral sense first,
Mhm.
that it's going away from a particular norm of behavior.
Okay.
Now, when we say disease, we're looking at a medical umbrella of it. So if something is sick, it's a disturbance of normal functioning, but it is more targeted to a specific disease, more biological.
Okay.
Now, anxiety is also a syndrome,
Mm-hmm.
more specifically, a syndrome
Okay.
of a disease. So when we say a syndrome, what are we looking at? A number of symptoms that occur together, and it's a characteristic of a disease. So anxiety can be a syndrome of a serious disease.
Uh-huh.
So anxiety is a part of a larger picture or a larger scope.
Okay.
Right?
Okay. So, when you say a larger scope, can you tell us a little bit about what that larger scope is?
Absolutely.
Okay.
Perfect example what we have going on right now, the coronavirus.
Uh-huh.
Well, we are correct to be nervous,
Mhm.
anxious, because for some, if you have a lowered level of health, it could be very serious for you.
Right.
But what do we see behind that? A lot of worry, right?
Right.
So worry and anxiety are two different things.
Mhm.
So worry pretty much is a thought process,
Okay.
and anxiety accompanies that thought process,
Okay.
right?
Okay.
So we're looking at a medical situation. So if we're looking at the larger scope, we can say, anxiety is caused by heart disease,
Mhm.
which it can
Okay.
be a symptom of heart disease. It could be a symptom of diabetes.
Mhm.
It could be a symptom of asthma and a plethora of other health conditions like hyperthyroidism.
Okay.
So that's a larger scope from a medical sense.
Okay.
From the behavioral sense, well, then I guess I guess we can get to that if that's what you want me to jump right into.
Yes, that would be
Well,
good.
I have some little notes here.
Okay.
So when we're looking at the behavioral sense, I have my notes here,
Uh-huh.
and I jotted them down. So we have various types of anxiety disorders.
Uh-huh.
Okay, it's quite a few. Post-traumatic stress disorder, right? So that is exposure to something traumatic, something, terrible, something that caused an acute stress reaction,
Mhm.
and PTSD is the long-term effects of that.
Okay.
And you don't have to actually have something traumatic happen to you specifically. You can witness something traumatic
Uh-huh.
and, live through PTSD. Also, obsessive compulsive disorder. Those are the intrusive thoughts, and not so much as the behaviors, it's the thoughts that causes the behaviors. Now, this is the difference,
Okay.
and I wanted to make sure I specified. There's obsessive compulsive personality disorder, and their symptoms are one and the same. That nervousness, that having to repeat something, the compulsion. But the personality disorder is special in that the person is not aware that there's an anxiety situation going on.
Okay.
Whereas the individual with OCD, they have a specific goal, you know, like washing your hands too many times because you're thinking you're getting all the germs off.
Okay.
So a person with obsessive compulsive personality disorder, they're just doing it without meaning. So there's no particular goal or target.
Okay.
So that's the major difference. And then we have our specific phobias. And we all experience this in some way or another. Some people are terrified of needles.
Right.
Some people are terrified of dogs. It doesn't matter how big or small. They're just terrified of dogs.
Right.
Right? And so behind that is the perceived thought of danger. Mostly with all phobias or anxiety situations. Generalized anxiety disorder. Well, there's no specific thing that you're fearful of or a perceived threat. You're just generally anxious, generally nervous, and it could apply to anything across the board.
Okay.
You have panic attacks.
Yes, I was going to ask about those.
Okay, well,
Well, you know, go ahead. You go ahead, because I've known people to have panic attacks. I've seen somebody have a panic attack, and it's like it just comes all of a sudden.
and they do.
Yeah,
They absolutely do. And I'm sure looking at it is frightening. And so
Yes.
for the person who's experiencing it, it's terrifying.
Yes.
But they're relatively harmless. So the panic attack is just that, an attack. You know, it can just happen.
Right. So it's just
once or twice.
a thought just come to their mind, and
It can.
it just gets them out of whack, and they can't. It's like they can't control it, or what is happening?
Yes. So what's happening? That panic attack is usually singular. So when you're having recurrent panic attacks, that's the panic disorder. So you can be diagnosed with panic disorder. So these are sudden, recurrent attacks of panic. Your blood pressure's up, your heart's beating fast, you're jittery, you're nervous, you can't sit still. Some individuals even experience blacking out because they're hyperventilating
Right.
so deeply. They lose consciousness for a short period of time, you know, and they're not really taking those deep breaths.
Right.
So that's really what happens. And there's kind of a process to that too. Before you get to that point, and that's that awareness and unawareness, you start with the triggered thought.
Okay.
So a trigger. What is the trigger? A trigger can be anything.
Right.
You know, some people are triggered by a car engine starting. Yeah. It just depends on what happened with that car engine starting. A car engine starting, a sudden noise, you know, dropping something on the ground and it shatters, it triggers something. Or it could be you holding something fragile and you're thinking, oh my gosh, I am going to drop this. You have that what if situation in there. You begin to ask yourself, what if I do this, or what if this happens? Once that happens, now you've got the cycle going. You're starting to panic. You're starting to have that excessive worry. You're really starting to tip over. You know, it's kind of like that Bell's curve, where you're just right there on the edge, but you can go over at any minute. So that's kind of what's happening.
Yeah.
And then afterwards, it's that feeling of exhaustion. I'm not sure if, you know, this is something personal or what have you, but people that experience these panic attacks, they have that moment of exhaustion. They're just needing to take a deep breath. They're thinking, whew, this is tiring. And they stay in that state all the time. And so being that they never come down, they're constantly in that state of panic. They're constantly in that state of nervousness.
Wow.
Yeah.
And so, you know, because there is one person that I know, they went to a Walmart store.
Oh, my.
And when they walked in, I don't know what, I mean, I haven't experienced it, but I experienced them having a panic attack. It's like they weren't able to breathe. I don't know if it, and to them, they said it was because there was so much, it was like just so many people, the big open space.
Yeah.
But they hadn't always been this way. It was like all of a sudden.
And that could happen.
Mm-hmm.
That's that total unawareness.
Mm-hmm.
That can happen. And that's very similar to the agoraphobia.
Okay.
You know, and that's a form of anxiety. And I actually noted that just now, and you must have read my mind. So agoraphobia, and that is, you know, having a fear of places.
Mm-hmm.
Being in a large place like Walmart, that can incite any kind of anxiety for just the average person. The
Right.
long lines, you know, the crowded area, you're just wanting to get in and get out.
Mm.
But that is a huge, you know, that's a huge part of you pointed out there. And that's,
Yes, and you know, and of course, you know, they began to hyperventilate. So we had
yeah.
exit out of the store, and once they got back to the car, they could kind of come down from that. But now they are aware that I have this. What caused that? Why all of a sudden now I'm afraid to go in Walmart stores, or I'm afraid of this big wide open space. You know, I don't know. But so when is it time to seek medical attention? You know, because everybody, like you said, everybody experiences some type of anxiety
They
in
do.
one
They
form
do.
or another. At some, you know, it
Absolutely.
could be, you know, like when somebody gets ill and you're, of course, you get anxiety because you don't know what to do.
It's that
you know.
unexpected area.
Right.
Yeah.
So when is it time to seek medical attention?
It is really time to seek medical attention when your level of functioning is very impaired.
Okay.
You're not leaving your house. You're having to perform these rituals that really don't mean much. You're not able to answer the phone. You are crippled with that nervousness, that tension, that anxiety, and that perceived fear. Also, what I would encourage, because anxiety could be a symptom of a real life medical condition, is to genuinely get yourself checked out.
Okay.
Because more often than not, if you start to experience, a lot of the times when you start to experience anxiety and it seems like it comes from nowhere, it's a good idea to check your blood pressure.
Okay.
It's a good idea to check your heart function. I mean, because when the heart starts to decline, you have difficulty sleeping. You are in a state of anxiety and you can't seem to figure out why. So that's your body giving you a message like, hey, I need something checked out.
Right.
And more often people are traveling to hospitals and clinics and checking themselves in because of panic attacks. And so, you know, doctors sometimes can pass it off or misdiagnose it and just say, well, it's a panic attack and not really check.
Right.
But it's a good idea to really get it checked because you never know what you're sitting on in terms of anxiety.
Right.
Yeah.
Because I remember I had a situation where I had to take someone to the hospital because they had a panic attack. Of course, well, that's what the doctor diagnosed it as, panic attack. And so, just wondering, but after they had that particular episode, they were able to overcome and continue on what they were doing from the first time. Well, from the first time they had it, there was like no apparent reason. This was like, actually, they thought they were having a heart attack.
Yeah.
And so that's why we went to the hospital, to the ER, because they were experiencing, I guess, the heart palpitations and, you know, all this, that, and the other that goes along with that. And of course, you know, because the doctors couldn't find anything, they took the blood blood work and, you know, all the other things they check you out. And they said, well, the only conclusion we can come up with is that it's a panic attack.
Right.
And so from that point on, this person did have one or two more episodes, but they did eventually, from all seeing, I can't think of the word I'm trying to use, but anyway, it seemed like they have overcome that particular disorder that was trying to get a hold to them, you know, so.
Well, they're one of the lucky few.
Yeah. Now, I don't know if anything else would trigger, but you know, when it comes to these disorders, are they normally hereditary, or does it just seem to be hereditary?
That's a very good question. And I think that's something, you know, the world needs to know as well.
Right.
We all come from someone. You better believe that your makeup and how you progress as you age is all a part of your ancestry. You understand? So when you're experiencing a particular disorder, more often than not, you were you have a particular risk
Mm-hmm.
in your particular family for it.
Right. Okay.
So yeah, there are some serious, some risks that are associated with it. Like if it's in the family,
Mm-hmm.
more than likely you'll experience it, or somewhere in your bloodline, it is present.
Okay.
It is very much present. So yes, it can actually be a part of you
So
genetic wise.
okay. So does it come from like some kind of chemical imbalance, possibly
Yes, that too.
that runs in
Yeah.
families?
Yes.
Because
Yeah.
you know, I've had quite a few uh, people that I know
Mhm.
that's like within the same family to experience
Mhm.
anxiety, and it's like, okay, I begin to think, okay, is it because it's hereditary, or is it because this person is around this person and they have, you know, how you kind of start
Oh
adapting
yeah.
other people's
That's true.
behavior,
Yeah, that's true
you know,
too.
that
Yeah.
you're around, because you know, like they said, birds of a feather flock together, and you know those types of things. So is that part of it, or is it just genetics?
That's true as well. It's
Mm-hmm.
genetics as well as environment.
Environment. Okay.
So I mean, we're all exposed to so many different things.
Mm-hmm.
So if you've never had, a panic attack now, you could have so much stress going on
Right.
in your life that you're not addressing,
Mm-hmm.
and then one day when you're unaware of it or unconscious, and you just have a full-on panic attack just because you are stressed out.
Okay.
Environment.
Mm-hmm.
And then you could have it chronically to where it is a disorder and you do need medications to
Mm-hmm.
help you.
Okay.
So it is important to treat anxiety medically as well as behaviorally.
Okay.
Mm-hmm.
Okay. So anxiety is one of those things. Now, the time that I remember, you
Mm-hmm.
know, when I had lost someone, you
Mm-hmm.
know, that became very stressful for me. And I don't know if it was, I don't know, maybe I was grieving. I don't
Mm.
know what it would be called, but when I would go past the cemetery, I would get this feeling of just overwhelming feeling.
That trigger.
Yes, that trigger.
Mm-hmm.
Because I know this child is out here, and you know it was just something I had to eventually I've gotten better, you
Of
know, but
course.
at one point it wasn't easy to pass by the cemetery.
Right.
So is this um would that be considered like anxiety, or is that just grief?
A touch of both.
A touch of both.
If you haven't had a chance to really reconcile that person's loss,
Mm-hmm.
you could be experiencing prolonged grief
Okay.
or complicated grief as well. It's a
Mm-hmm.
combination.
Okay.
And anxiety. So, all of that's involved. And when we're talking about grief, we're also talking about episodes of depression or prolonged depression.
Mm-hmm.
So, depression and anxiety, I want to say interlaps.
Okay.
They do.
Okay.
They do. You usually see depression and then you see anxiety right behind it. They're brother and sister almost.
Oh,
So.
okay. Okay. I hadn't heard it termed that way, brother and sister.
They're brothers and sisters. You don't see
Uh-huh.
one without the other all the time.
Okay.
I mean, you usually see them close together. So.
Okay. So what about any of the other disorders? You know, like bipolar depression.
Ah,
I know we don't have to get into it
We-
deep, but you know, just touch it.
well, now that's a little interesting. So that stems from, oh God, that root is very complex. So when you're looking at bipolar, you're depending on where it is, bipolar 1 or bipolar type 2.
Okay.
Bipolar type 1 is usually associated with psychosis. And so bipolar 2 is mostly depression.
Okay. Okay.
So they live together side by side and they are one.
Okay.
Except at times you'll have an episode of mania
Mhm.
or mixed mania.
Okay.
So you have those highs and
Mhm.
then you have those lows.
Okay.
And so almost every mental illness that you find in our diagnostic statistical manual,
Mhm.
which is number 5, we're on number 5 this time, you'll see that they're presenting symptoms in a lap,
Uh-huh.
and you'll find that. So if you have depression so long or so deeply felt,
Mhm.
it can actually turn into psychotic depression,
Okay.
right?
So that comes into that's the bipolar. Would that be considered bipolar?
Yes, that can
Okay.
be considered bipolar.
Mm-hmm.
And then you have anxiety to the point where you're depressed because you're anxious and you're not resolving those issues.
Okay.
And so, yes, they do interlap. Almost all of them interlap.
Okay. So the main thing is most
Ruling
of the
out.
time is you have to deal with, but that's where you come in as a counselor.
Yes.
You help us to talk about those things that we're dealing with that we haven't been dealing with properly in order to get rid of the anxiety and the depression.
Exactly. I
Okay.
know, I hear a lot of individuals say, well, I've been handling everything just fine.
Hmm.
You think you're handling everything just fine,
Right.
but when others are around you, they're noticing your mood swings. They're
Hmm.
noticing your nervousness or your tension.
Hmm.
They notice that you're snapping at them.
Okay.
They notice that you're not going out the house as often. They notice that one day you're overspending and you negatively withdrawn your bank account, and then the next day you feel bad about it.
Hmm.
Others are seeing this.
Right.
So, don't be so quick to say, well, I'm handling everything just fine.
Hmm.
There's nothing wrong with speaking to someone. We all need someone to talk to.
Right.
But it would be a good idea to get a clinical opinion as opposed to just a layman's opinion.
Hmm.
They do their best and they're great. Our
Hmm.
friends are great to have. Our family is wonderful to have. But they have just that, a family and friend opinion, not
Right.
a clinical opinion. They don't understand how to look deeper for something that's there to help you
Right.
make a meaningful connection.
Hmm. And I know that many times people don't want to discuss. We don't like to discuss us.
Yes.
You know. So it would be good if we were to seek the help of a professional, because and when we seek the help of a professional, everything is what's the word I'm looking for? Um, it can't be discussed
That is,
outside
yeah,
of the counseling.
that is correct. It's
Okay.
very confidential.
Confidential. That's the word I was looking for. It's very confidential. So if you are experiencing any of these conditions, Mrs. Harper with New Paths Foundation can help you. This is what she does for a living. She provides counseling for depression and anxiety, and we know that as from the discussion today that depression and anxiety are brother and sister.
They are.
So, and brothers and sisters can be very close,
They can.
and they can be different too. But they love each other, so they like to be around each other.
They love to be around each other, and
Yes.
trust me, they need to be treated as separate entities. You have to
Okay.
treat the depression and treat the anxiety,
Right.
even though they're brothers and sisters. I believe.
Right. So, in order to get this help, um, would you like to give out your information so that if anyone is interested in, talking with you in a confidential way, they're welcome to do that. I'm sure.
Yes, they are.
Okay.
So I can actually be reached, and I'm
Uh-huh.
going to give my phone number out
Okay.
to the office. It's 205 304 1082.
Okay.
You can call at any time to schedule an appointment.
Okay.
Sessions start at $50,
Mhm.
and that's per session,
Okay.
and it goes up based on your needs.
Okay.
Also, I do have parenting and development classes,
Mhm.
and I also have a coping and social skills group for those that need it.
Okay.
And what I didn't share is that I also provide notary services for clients that are needing, convenience of having legalized documents.
Okay.
So I provide that. And if they want to, they can check me out on my Psychology Today profile
Okay.
under my name, and they can schedule an appointment that way.
Okay. Now, children. When it comes to children,
Yes.
do you have many children that need help for anxiety, or is it more depression?
Believe it or not, our children are living with anxiety. There's a lot going on in our school systems that are more known to the parents and the community now than it was, let's say, 20 years ago.
Right.
It's very out there. We've got bullying going on. We have children that are taking the roles of parents right now.
Right.
They're full of anxiety, and that's called parentification, by the way, where the child is taking on the persona of the adult,
Mm-hmm.
and they become confused. That's that identity confusion.
Okay.
And back to bullying, yes, you have bullying because you have, a more accepting society. It's more accepting to be a valued member of the LGBTQ community,
Mm-hmm.
as well as, being unapologetically African American and loving your roots,
Mm-hmm.
and unapologetically European American and loving your roots. It's more accepting, but there's still those few that do not. And so there's a lot of tension in the world with our kids, and they're trying to figure it all out.
Mm-hmm.
So, yes, there is anxiety with our young ones.
Okay. So children, and
Mm-hmm.
if you're seeing these signs,
Mm-hmm.
seek some help for your children
And yeah,
so that they don't have to become an adult with a bigger problem.
absolutely.
Bigger problem.
Absolutely.
Mm-hmm.
I hear a lot of parents say, well, my child doesn't need help. It comes from a very narcissistic or egotistical perspective. It's
Mm-hmm.
not about you anymore, per
Mm-hmm.
se. It's about the child,
Right.
getting the child the help he or she needs
Mm-hmm.
while they're young so they can be productive adults.
Right.
What we see a lot of the times with our youngsters are sleeping pattern disturbances. So they don't normally say, "Hey, I'm having a hard time." If you notice they're not sleeping at night,
Mm-hmm.
that check that out. There's an issue there. Something's going on.
Okay.
If you notice that they're more withdrawn,
Mm-hmm.
check that out. It could be depression. It could be anxiety. They're trying to figure it all out. If you notice that they're acting out, depending on the developmental age,
Mm-hmm.
that's an issue. Something's going on. If you have a normally good child and now they're acting out, they're trying to communicate something. They need you
Right.
to see something. So those are just a few of the pointers to put out there.
Okay. All right, then. We sure do appreciate you being here with
Thank
us
you.
today. And if you want to give your number out one more time,
Yes.
so that if any of our listeners are interested in getting in contacting you, it may not be for themselves, but they may know a neighbor, or they may, because we are our brother's keeper, even though
We are.
sometimes we tend to just sit back and watch until things happen. They get out of control, and we see somebody maybe go in and they shoot up a school, or somebody commit suicide, or they do something.
That is correct.
Whereas if we would have been intervened, been a brother's keeper, then
Absolutely.
these things could have been avoided.
Absolutely.
So give out your number one more time, and then we're gonna
Yes.
take a break.
It's 205
Mhm.
304 1082.
Okay, and we thank you so much for being here with us
Thank you.
today. And Mrs. Lanetta Harper, she is the mental health counselor from New Paths Foundation. And thank you again for being on the show today.
Thank you for having me.
And we will be right back here on Smash Bros Radio. This is the Sweet Lady and the OT Gospel Show. babies. And we are here yet again in the studio with the Sweet Lady and OT Gospel Show at Smash Bros Radio. And today we have in our studio with us discussing the real of mental health, anxiety, our mental health counselor, Mrs. Lanetta Harper, with New Paths Foundation. And we have been discussing those things that affect quite a few of us when it comes to our mental health. We know that our mental health is just as important as our other body parts' health. You know, many times we don't want to go to the doctor because we feel like there may be something wrong with us mentally, but if we can't see, we're going to the ophthalmologist or the optometrist. We're going somewhere. We're going to get some help. And if we have a heart attack, we're going to the hospital. We're going to go and make those visits to our cardiologist. If we are diagnosed with cancer, we're going to make sure we keep our appointments with our oncologist.
Absolutely.
So, if we are having mental health issues, why not go and see our psychologist or our, what's the other name, Mrs. Harper?
Okay, we have psychologists,
we have psychologists,
psychiatrists,
okay,
and we have therapists, clinical mental health therapists.
Okay.
These are all licensed professionals.
Okay.
And if you want to take a spiritual route, some of our spiritual counselors are licensed, but then you have mostly counselors with just really good intentions, and if that's who you trust, then I'd say go there.
Okay. All right. So when we discussed about when to when to seek help.
Right.
And if anyone would like to call in, we have opened up our phone lines. You can call in and talk with Mrs. Harper if you have a question. And the number is 205-848-7464. You can call in with your questions for Mrs. Harper at this time. And we were discussing about different things that occur when you are experiencing anxiety. Can you recap on that for us a little bit? Just like what goes on with the person, so that we can kind of know what's going on with us. I mean, like I said, I was having a problem when I would go by the cemetery because I know I have a loved one out there, and it would just kind of get me out of whack.
Okay. So anxiety overall is simply our emotional and physiological reaction to a trigger.
Okay.
And it causes excessive worry, that intense feeling of panic, as well as other physiological responses such as hyperventilating. But what I didn't touch on was I just want to touch on it slightly, just to inform a lot of your viewers on what treatment options are available, and these are not the only treatment options. They'll find out a lot more of this with their psychiatrist, who actually prescribes the medications, and we as counselors help to manage those medications. So one of the things I jotted down was benzodiazepines.
Okay.
Now these medications are not usually prescribed for everybody. They're prescribed for certain people. They act as tranquilizers, and they can be very addictive.
Okay.
So taking these medications, you have to be closely monitored by your physician, because you could accidentally overdose with benzodiazepines depending on what else you're using.
Okay.
There's a huge substance abuse epidemic, and so people are mixing medications. That's very dangerous, especially with benzodiazepines. So what are benzodiazepines? Xanax.
Okay.
I see that a lot. Klonopin, Valium,
okay,
Ativan.
Okay.
So
those are the ones I've heard of.
Right. You'll see those prescribed a lot for certain people. Now, they have what you call safer, medications, which are our selective serotonin reuptake inhibitors, SSRIs. Okay. So these act on hormones.
Okay.
When you take an SSRI, you are increasing your feel-good hormones, right? So that's decreasing depression or anxiety and making you feel better, feel good, feel euphoric. So some of those medications are Prozac, Zoloft, Celexa,
Uh,
and Paxil. And some people argue, well, Paxil kind of makes you feel tranquil as well. And it can.
mm-hmm,
It makes people feel very sleepy.
mm-hmm.
And then you have Buspar. Um, I didn't write that down, but I thought about it as I was speaking. Then you have Buspar, which is a newer medications now that they're prescribing for anxiety. Um, and of course, you have to make sure you take that medication regularly because it takes about depending on the person, 2 to 6 weeks for it to actually start working.
Really?
Absolutely. And some people, they start to say, well, this is not working because they're not giving it enough time to work.
Mm-hmm.
What just came to my mind? Beta blockers.
Okay.
And these beta blockers are used to treat high blood pressure or hypertension,
Mm-hmm.
but they're also used to treat heart conditions,
Okay.
and they also can work to lower anxiety. And so I guess whatever you're prescribed would be based off of your doctor's opinion and your medical history.
Mm-hmm.
So those are some options.
Okay. Okay. All right. We are taking calls now. If you would like to call in and speak with Mrs. Harper, the number is 205-848-7464 right here on Smash Bros Radio. Okay. And Mrs. Harper,
Yes.
we discussed when to go to when to seek help.
Mm-hmm.
Uh, what are some other? I know that you said mention about the emotions.
Mm-hmm.
So is anxiety mostly emotional?
That is a good question.
Mm-hmm.
Um, Anxiety is mostly physical.
Physical. Okay.
Yes. So the worry.
Uh-huh.
Remember, there was a difference between worry and anxiety.
Right.
So your worry
Mhm.
are the negative patterns of thinking
Uh-huh.
with a lot of doubt. Then the anxiety comes with it,
Uh-huh.
and that's mostly physiological, the reaction to it.
Mhm.
So both of those combined.
Okay. So you mentioned just then that
Yeah.
it's a lot of like self doubt.
Mm-hmm.
So
Yes.
in counseling,
Yes.
do you try to help someone to like begin to have higher self esteem, or
That's a
do
really
you
good
find
question.
that
Yeah.
those connected that someone with very low self esteem tend to be more prone to anxiety?
You know what? That's quite capable. I mean, that's quite possible. Sorry.
Mhm.
Yes, someone with a lowered level of self-esteem could approach a situation. Say, what are we having now? Our kids going to college. Well, if they're self-doubting themselves, they have excessive worry. Well, what if I don't get into this particular university? Will I disappoint my parents? Would I disappoint myself? Will I ever have a future? That what if?
Right.
Those
right.
what if questions. And so they continue to approach the situation like that, and they're starting to doubt themselves. It's lowering their self-esteem and what they're quite capable of doing, and they can get into any university, but it's that panic and that worry.
Yes.
So yes, when we are seeing a person, say for instance, a lot of the treatment options we use are cognitive behavioral therapy. So the way you think is the way you behave. So if you
Right.
can alter the thoughts, we're hoping to alter the behavior.
Mhm.
And it really depends on where that anxiety stems from. It depends on the approach that we use. There's hundreds of therapeutic approaches out there, and each one is for somebody. We just have to figure out where the problem is coming from. Is it a medical condition, or is it a genuine behavioral condition only? Is it a learned condition?
Right.
That's what we ask. We ask a lot of questions to figure out which technique would be best for that person and how to go about helping them.
Yes. And something you said just then brought the scripture to my mind. The Bible tells us that as a man thinketh in his heart, so is he. So that, would tie into, the way that we think. Because, the Bible tells us what to think on.
Yeah.
But it also tells us that if we're not thinking proper, however we think, that's who we are. That's what we are, and we do those things. So it tells us how to elevate our thinking and how to deal with those things that may be troubling us, because of the way that we think. And so being a counselor,
Yes.
You can help someone who doesn't know how to approach, because many times we just don't know how to approach our problems.
Mm-hmm.
And you know, we
That's
have
true.
so counselors and psychiatrists and psychologists have been trained, therapists have
Mm-hmm.
been trained to teach us how to approach our problems and how to resolve them.
Mm-hmm.
And you know, there goes again. You know, many of the problems, the situation that we have with the crime and the crime on one another is because we don't have conflict resolution skills, which we don't know
Absolutely.
how to approach the problem because we haven't been taught how to think to approach the problem, to
Absolutely.
resolve the conflict, to keep us from hating one another and getting to the point where we want to hurt one another.
So
And
that's lack of knowledge
mm-hmm,
as well as patience.
right, right, right.
Lack of
So
knowledge and lack of patience.
just so many things. But anyway, again, we thank you so much for being on the show
Thank
with
you.
us today. And I think our time is up. What time do we have, JB?
3:31.
Okay, yeah, our time is up today. I was hoping someone would call in with questions they may have if they want to, you know, speak with you. But if not, your number again, they can call you and talk to you in a confidential way
Absolutely.
at
205
okay,
304
mm-hmm,
1082, or you can sign up for services through my Psychology Today profile.
okay, Psychology Today profile. Okay,
Mm-hmm.
this is Mrs. Lanetta Harper. She's been in the studio with us today discussing the real of mental health anxiety. She's from New Paths Foundation, and you can call her and make an appointment with her in a more confidential way and you know get some help if you need help. You know, sometimes we don't realize we need help, but sometimes we do know that we need help and we don't have any direction as to who we can contact, how to go about contacting them. So we are here at Smash Bros Radio. We are trying our best to help as much as we can in every area. And mental health, as I said earlier, is just get some help if you need help. Just like you would if you were to stomp your toe. You want to get some help if it turns bad and it starts to turn colors and you're going to the doctor. You're gonna seek some help. So let's not wait till our minds start to deteriorate so bad that we are become suicidal or we want to hurt someone else. Let's
Mm-hmm.
get some help.
Mm-hmm.
All right. Thank you again.
Thank you.
And we appreciate everyone who has tuned in today. And I'm sorry I couldn't do both. I told you all when I first started this show, I am not. I can't seem to do the show and talk with the people online at the same time. So, but anyway, we're thankful for everyone who has tuned in today, and thank you again. We'll see you, Lois willing, next Saturday at 2:30 right here on Smash Bros Radio. And remember, dear ones, whether therefore you eat or drink or whatsoever you do, you want to do it all to the glory of God.
I may have fame to my name. I may have everything that life could bring and still remain the same. I may have the house, the cars and jewels and all. I might become a star. But I will always serve, oh serve you. I will always serve you. Jesus, I may be rich, I may be poor, I may be a nominee for the Grammys and but I will only save, oh, save you. I will only save Jesus. I will only save, oh, save you. I will only save I